On today's Compass Wealth Conversations, we have the honor of speaking with Dr. Jason DeLeon and Rita Gillespie of D&G Optimization. In the last year and a half, they have gone from clients to friends to me being one of their clients, and they have helped me take control of my wellness journey. You actually work hand in hand with Jason and Rita to optimize your health as you navigate the roadway of life. Jason and Rita, welcome to the Compass Wealth Conversation.
Yeah, thanks so much for having us. I mean, all in all, this really happened as a result of me feeling pretty poorly about 5 years ago and kind of struggling. I was telling Rita, I'm like, something's off. Caught myself kind of struggling, like really almost falling asleep at work. And as an emergency doctor, that seemed kind of psychotic. I kept telling her, I don't know, maybe my testosterone level's off. And it wasn't that I was having a sex problem or anything along those lines. It was just, I felt crummy. It didn't matter what I was doing workout wise or eating wise. I just couldn't lose weight. And anyways, we went, saw this kind of doc in the box guy, and he ran this ridiculous lab panel for me. Spent $2,000 on that panel and ran through things, answered some questionnaires for him. And he was like, well, your testosterone level is really not that low, but hey, I've got some Viagra for you. And I was like, I don't have a sex problem. Not sure how Viagra is going to help me. But all in all, got frustrated in that scenario and went and saw my primary doctor, and she was a sweet lady. She found out that Rita and I were both docs, and she was like, gosh, I feel bad that joints hurt and you feel crummy and you can't lose weight, but I don't know what to order. She turned the computer around. She was like, just order whatever you want. So thought that was kind of crazy. I really wanted somebody to help me rather than me help myself. But mind you, I did order a huge lab panel. Came back and looked over the labs, and she was like, well, yeah, you're borderline diabetic, but don't worry. Next year, we'll just put you on Hormone. I was like, why do I have to feel like shit for this year? Why do I have to wait until next year to feel better? All in all, luckily, we ran into the right doctor who looked at my labs a different way and was like, yeah, we should start testosterone and thyroid hormone so that we can prevent you from having diabetes in the first place. And I was like, that's against the rule. My testosterone level's fine according to numbers. He was like, well, but compared to the 1970s, you're about 1/3 of where you would have been then. So he convinced us to take this course with him and just really opened our eyes to a different side of medicine.
So Rita, how did you feel about the course? Because you're not experiencing the same thing Jason is, but.
Yes. Well, from my standpoint, I was, 5 years ago, menopausal. So dealing with, hot flashes, can't sleep, irritable. I've always been on the thinner side, and then noticing starting to put weight on despite, my usual routine and how we ate. And then realizing that, hormones are so important, for us, once you hit menopause going, forward and protecting my brain, my bones, my heart. So, I went with him and, I was like, wow, okay, we're going to go take these courses. And it took us 2 years to complete. So it wasn't just the weekend course. And it really just opened our eyes to a different side of medicine, like that we're kind of doing things wrong in, mainstream medicine where we're kind of being reactive instead of proactive. I really think that, we can really truly help people and prevent them from going down, the pathway of diabetes and cardiovascular disease. And
Yeah, because I am a client of yours, right? So, and I was feeling the same way that Jason, you were talking about, right? Like exhausted at 3:00, like belly weight, right? Like I was walking, doing some stuff, working out. It wasn't really where it was, right? And it's at some point you just have to be in the mindset that you're going to do something about it. And so I met you through Brendan McPoyle, who we've met on the show before, and we just kind of had a conversation about it. And then you kind of gave me kind of what you went through, and I was like, oh, that's kind of the same thing, right? Because with me, it was more about, I couldn't lose the weight. I wasn't feeling great. And then my doctor wasn't giving me the options, like you said.
And unfortunately, it's one of those things where in med school, I think we had a day of hormone knowledge or stuff presented to us and maybe a day in nutrition. Reality is that part of things is so important to spring people in the right direction. And if it's even just a little bit off, everything's off. Mm-hmm. Mood, energy, metabolism. And reality is even the scary things like cardiovascular disease, Alzheimer's, and everything else that happens as a result of your machine just not working the way that it's supposed to. So, yeah, I mean, obviously this opened up our eyes. I mean, at the time I was 255 pounds. I now weigh somewhere between 180 and 185, depending on if I'm interested in packing on muscle or shaving off fat. And, you know, it's not just hormones. It's really a matter of also, you know, kind of a three-pronged approach. Like there is work that has to be done. You have to get steps. You have to make some dietary changes. So those are things that we really focus on with everybody.
And is it a one size fits all? Like, you know, I know what I'm doing, right? I know what you guys did with me, like a multivitamin, I'm on a thyroid medicine now, those types of things. Is it a one size fits all? Because you do wellness and you do testosterone, right? So is it a one size fit all? Is it cream? Is it pellets? Is it vitamins? Is it supplements? Kind of how does that go, Rita?
So it's definitely not. And that's what is very different about this type of medicine. Mm-hmm. And I think that that's where a lot of clinics that seem to be popping up everywhere are having difficulty with, because they feel like they can just give the same thing to each patient, but each patient is different. What's going to work for Jason is probably not going to work for you. Mm-hmm. And so there's got to be a close connection, you know, with your provider. And that's what we try to offer. You know, patients have our cell phones because I need to know how you feel. You know, because maybe we need to either go up or go back down on medication. So that's why it's very important, because if I see you and then 4 months later you come back in for follow-up, you may say, this stinks, I don't want to do this, because we weren't dealing with what you were experiencing. Right. And you talk about the different, you know, methods. I mean, yes, there's different delivery methods for the hormones. You know, there's creams, there's pills, and then there's shots. Mm-hmm. So again, that also comes down to what is going to work best for the patient. Some patients can't take something on a daily basis. So that's why the other delivery methods may work. So yeah, we just really work closely, you know, with the patient.
So would the shot be not daily, right? Compared to like the pellet or say a cream?
So the cream is something for, you know, males would apply the cream twice a day. Women is just once a day. With the shots, it's typically twice a week for men. Mm-hmm. And then with the pellets for men, you put it in. So for those that don't know, you know, you make a small incision kind of in like the love handle area, mm-hmm. And insert, you know, a pellet, and that slowly gets broken down. For men, 4 to 5 months it's supposed to last. For women, 3 to 4. But if you're very active, under a lot of stress, you may chew through that much quicker. Mm-hmm.
So when I did my panels with you guys, I had already gone to my primary, and I said, listen, I'm exhausted. Like, I'm not doing this. Why don't they run the panels? And you know what I mean? Like, because you said that at one point you had said to me that they're not going to run those panels.
I wish I had a really good answer for that. I mean, I think the reality is that, you know, one of the things that I think is so important for a physician to look at, to know years before somebody is destined to have diabetes, is to see what their insulin level is in combination with what their resting glucose level is. Because when you put those two numbers together, you create a score. It's called a HOMA score. Anything greater than 2 suggests that there's insulin resistance. And the reality is unfortunately, because of the way that food is in the States, we're so carb driven. You have a hamburger, it's got bread. You have a meal at a restaurant, they serve bread. Not that bread is the devil, but the reality is too much bread is the devil. And over time, our bodies just try to accommodate that increase in carb load by bringing up those insulin levels in our bodies. That changes 10, 15 years before your hemoglobin A1C changes. That's what your doctor focuses on. And in all honesty, that's what we focused on before we fell into this. You know, now that's a main focus for us. We need to know ahead of time. That way I can tell somebody, hey, you do need to make changes. It should be a higher protein content that you're bringing into your system before you even think about carbohydrates. You know, it's unfortunate. I think that we've gotten to a part in medicine where people are so focused on statins and changing cholesterol numbers, whether or not there's a true cardiovascular issue underlying in an effort to prevent that. But those drugs aren't without their own set of problems. You're on a statin long enough, you will develop diabetes as a result of the processes that happen in your liver. It is inevitable, and it happens to a lot of people.
Yeah, because I didn't know that I was on my way to diabetes, right? I knew I was a little bit overweight and doing some things, and I just didn't have any idea because I wasn't told until we did the panels together, right? And it was one of the questions because, you know, my dad has some heart issues and he's diabetic now, but he was pre-diabetic a while ago. So for me, it's just, you know, kind of that, how am I going to check myself out to make sure that I don't lead myself down that road, right?
Yeah, I mean, and I think that that's part of why, you know, now that we see things a little bit different, it's just such an important piece of things. I mean, and that's the other side is like, then there's so many people that are like, well, I've got type 2 diabetes, I'm going to have it forever. You don't have to have type 2 diabetes forever. You need to make changes so that your body can function better on the inside so that that doesn't happen and doesn't continue. Now, does it mean that you're going to be able to eat a slice of pizza every other day? Absolutely not. It's going to be changing that to accommodate what your body is capable of processing. But does it get better? Sure. Now that I weigh 180 pounds, do I have an occasional slice of pizza? Sure, I do. My body processes it and I do well. Mind you, I feel well now and I have the energy to be able to work some of that off. And that's oftentimes what we hear from our clients is like, well, I'd love to go and walk and run or do some kind of exercise, but I'm so spent. I've got no energy. And fortunately, that's just how it happens, but it doesn't have to stay that way. We can fix that part so that you have the energy to do the work that needs to be done.
Yeah, and I felt that definitely because I after having the conversation started walking. I mean, even in that time, I'm down, I think it's like 32 pounds as of now. You know, I think I want to get about 10 more. Maybe I get back to high school weight, but we'll see what happens. For listeners wanting to learn more about your practice, Rita, how can they find you? How can we kind of get them involved if they wanted to say, hey, I want to just have a conversation with you guys?
So definitely can check out our website, which I guess we can provide that at the end.
Yeah, we'll throw that out there. Yeah, definitely.
And then, so, you know, definitely recommend getting on there because there's a lot of good information. You know, Jason's posted a bunch of articles that actually, you know, back up, you know, the science behind this, you know, that we're just not saying, well, you know, hey, you should do this because, you know, this is going to help you. There's actual, you know, data and you know, in all of the big journals, you know, cardiovascular journal, menopause, that's there that says that that hormones are safe and that this is what we should, you know, be doing. So once you know, seem like, hey, this is something I may be interested in, what we do is we send you a lab slip. Our labs are included in our initial consultation. You know, we will sit down for you for at least an hour. You know, that's 2 docs sitting with you for an hour, going over the labs, explaining how we see things and how, you know, we may be able to help you. And then after that, if someone is interested, it's a subscription-based, you know, service where, you know, you have access to us 24 hours a day, 7 days a week. Labs are included. You never pay for those. And because I think that that's the way that you need to do this in order for this type of medicine to work.
And then you also get kind of like a my chart because you can go through and you can see all your levels, you can see all your tests, you can walk through it, you can request anything on there, or you send a personal text, right?
Exactly. So, yeah.
It's more like a concierge wellness doctor.
And given that Jason and I are both, you know, emergency medicine based, if there's other issues outside of the hormones and wellness, we can definitely address those as well, you know, so.
And while insurance companies don't necessarily pay for hormone replacement therapy, they do cover everything else that they would typically cover. So we can send a referral for somebody to get their mammogram or any of their like normal testings. And that part is all covered through insurance. With you strain your neck and you need a muscle relaxant, something along those lines. That part all goes through insurance and there's no changes there. This is just a means of us being able to provide a level of care that you're just not going to get typically. And, you know, not that I want to tell all the other hormone clinics how they should do it, but the reality is an open line of communication, like Rita suggested, is probably the most important part of things. Because if something is felt or you've noticed a weird thing, rather than having to wait 4 months to see me again, just shoot us a text, get on a call, and we'll explain why you may be feeling this way and run new tests to make sure that everything's going the right way. You know, you had brought up about the different delivery methods. And, while we do pellet some people, I have a hard time selling those pellets to people as a result of struggling with that myself. Rita kind of alluded to the fact that if you have a stressful job or you're working out a lot, you just kind of chew through things fast. It left me with a little bit of a roller coaster. So, as a result, I think people do better with the cream-based approach because that way the levels become steady state and they stay that way. I mean, my testosterone level probably runs 2,000 all day, every day.
Let's talk about the levels real quick, because your primary levels, if you go to your primary care doctor, their levels are like 900, but you're saying 2,000. So, I mean, is there really a range, or is that where they just want to keep you in?
Well, I mean, so ranges come from, I think there was a time in my life where I looked at ranges and I said, oh, well, this is where you should be for safety's sake. And the reality is there's not a ceiling when it comes to testosterone. There's not a study out there that says that somebody that has a testosterone level like The Rock would be inappropriate or dangerous. Now, there are anabolic steroids that are definitely dangerous that people should stay away from, but that's not testosterone. And that's where, bioidentical hormone replacement therapy is different than some of those things. Even the studies from way back when that suggested that estrogen was bad or progesterone were bad, those studies weren't even studying estrogen and progesterone. They were studying synthetic versions of those medications. And yeah, they're bad. A progestin or a progesterone molecule that has a different sulfa group or hydroxyl group that the pharmaceutical companies can sell for an upcharge because it's a quote unquote novel molecule. Yeah, they bind onto the receptor, but they also cause downstream problems that you don't get with your regular bioidentical hormones. Your body cannot tell the difference between whether we applied the testosterone twice a day, whether your testicles made the testosterone. It's literally the same. So,
And I think that that's where the problem lies with a lot of docs because they don't understand. We learned it that, hormones were bad. And unfortunately, everything got lumped together. When they say estrogen, are they talking about estradiol, which is what our bodies make, or are they talking, about Premarin, which is a synthetic estrogen? So when they hear that, they're like, oh, hormones are bad for you. Well, your synthetic hormones are bad for you, but your bioidentical are not. They are safe. But unfortunately, docs, we have to learn a lot of information. You kind of learn, you hear something, you learn, said, oh, that's bad. And then just keep the blinders on and move forward instead of taking those blinders off and realizing, all right, what are we really looking at here? So I feel bad for patients where they, go see their doctor and they're like, oh, they told me that, hormones are bad. I should not be on these. Well, did you ask them why? And then they said because you just shouldn't. So they don't explain why. And then, or they'll tell them, well, you can only be on it for a certain amount of time. Well, why? You can, be on these hormones until you leave this, this earth. I have both my parents who are in their 80s on hormone therapy, and they'll stay on it until, they leave. They are safe, but unfortunately, people learn it one way and they just don't want to.
But that's why there's your primary care doctor, and then you have specialists, right? There's specialists for cardio, endocrinology, and then wellness, right? Because they're given the ballpark, like, hey, you're in this range, cool. It's a little low. Maybe you go see the specialist, right? So that's where we come to you. And that's how we found it. We had a conversation over Zoom the first time, right? And that's how we talked for the first little while, because you guys are in multiple states. It's not just like you're in Florida, and we got like I said, we introduced by Brendan, so we kind of had that connection already. But you can talk to clients all over.
Absolutely. I mean, we literally have clients in Michigan, Carolina, Tennessee, Colorado,
Georgia, Alabama.
Yeah.
Delaware.
Kind of all over. And, COVID kind of helped open the door for some of that, just because the borders were completely open way back when. But we've since, even though the borders technically have closed, we've just gathered our licensure in other states so that we're able to function and practice medicine literally anywhere, physician care anywhere. It's kind of how we want to build ourselves. So, all in all, we visit clients. I mean, we were Jersey yesterday visiting a client. That way we could, keep our ear to the ground and make sure that he's moving in the right direction as well. And not sure there's a lot of docs that would do that kind of thing, but
no, because then you got to come here. So
Yeah.
it worked out for me too.
Yes.
So when you were talking about like the hormone therapy, is it, when you hear testosterone, all you hear is you're thinking about males, right? Women clients, right?
Totally. So important. Throughout our lifetime, actually, you have more testosterone in your body than you do estrogen. Testosterone is so important for bone density. So estrogen and testosterone, once you hit menopause, definitely will help build bone. There's nothing on the market that will build bone. You have your bisphosphonates that will prevent bone breakdown, but they actually make your bones brittle over time. But they do not build bone. My mom has osteoporosis that, she's had for years. She's been on hormone therapy for 4 years, and her last DEXA showed actual increase in bone density, which is incredible. I don't need her breaking a hip, and that's and I don't want to break a hip. So that's why I think the sooner that you can start with this, the better protected that you're going to be.
That's one of the major kickouts for like long-term care and things of that nature, especially because we become frail. You break a bone, and usually you hear when seniors fall, they break a hip. It's a problem.
yeah, I mean, we see that in the emergency department all the time. You could have somebody that has their wits intact, no problem from a mental standpoint. They break a hip, the outcome long-term for them is awful. And oftentimes it's literally what takes somebody out, even if they're mentally with it and having no issues in that regard. That's something that literally changes somebody's life for them. So to prevent that from happening, absolutely. Which is why we struggle sometimes with people that are like, hey, I want Ozempic, because the reality is that there's some bone loss with Ozempic. I know the commercials are great and they show the guy eating ice cream and all of these kinds of things, but the reality is there is some payment that's happening with those drugs long term that I do worry term will be a problem.
Well, because they haven't been proven yet, right? Like I know people that are on it and they've lost a ton of weight and they look great and they're healthy and they're trying to, but they can't stop that. You don't stop taking it, correct?
Well, if you do stop taking it, then you potentially will go back to where you were or worse off with your weight if you don't make those other changes.
Mm-hmm.
Changing, your diet, making sure you're moving.
Right.
Even if you do come off it, the other side effects other than, the bone loss is the slowing of your gut, so the gastroparesis. So that's why you feel full, is because things are moving through more slowly.
Mm-hmm.
Sometimes that doesn't go away. And people come in and they'll be vomiting because, things are just not moving through.
Right.
So, potential, with that as well.
Because I made a choice, when we were talking, I went off bread and pizza for a while, kind of not so much a carnivore, but more protein diet, right? And I feel like now I can have a sandwich or a slice of pizza here, and it doesn't affect me the way that it did before, right? Even in the last 8 months that we've been together.
Well, that's what Jason said, is your machinery is processing things better, right?
Right.
Because when you lost your weight, initially it was that visceral fat that was around those organs that was clogging things up, preventing things from, doing their job. So that's what gets lost first, and then you start to see it, peripherally. But now, your machine's working better. Mm-hmm. So that's why you're able to handle something that's maybe higher in a carb than you were before. Mm-hmm. But I'm sure you're not doing that every day. Yeah. Right? Because you probably feel like when you do that, you probably feel a little sluggish, not as good, as when you don't do that.
Yeah, because we taught a seminar last night, and then I didn't eat, and I went to another meeting. So when I got home, I was like, I got to eat something. So I just made a quick sandwich, which I haven't been doing lately. But this morning, I was like, I'm a little exhausted today.
It's amazing that, and sometimes you have to do that over and over and over again. So do we have clients that are like, we literally watch their calorie content. We, make suggestions about where their protein levels should be. We allow for cheat days almost on purpose because I want them to feel and notice what they feel like the day after that cheat day. Mm-hmm. Because typically they feel like shit, for lack of a better way to describe things. Yeah. And so then you spend more time wanting to do the right thing with your body because now you feel. So came to Philly. I wasn't going to not have a cheesesteak. So I had a cheesesteak yesterday.
Where did you go though? That's the question.
So, well, we were coming back from Jersey, and so we went to Phil and Jim's. Or Jim and Phil's. Have you ever heard of them?
Jim and Phil's?
Yeah.
No, I haven't.
It was really good.
Yeah.
Really good.
Really good.
Nice.
The bread was stellar.
Yeah.
I mean, mind you, I very rarely do bread, but stellar. I ate the whole thing. I didn't even feel guilty. So
You can't feel guilty. But that's what everyone gets caught up in. Like, where are you going to go? You know, they're standing in lines at Angelo's and Del Rossi's. You know, that's kind of the business. So you guys just opened up a facility down in Florida, correct?
Correct.
How's that going?
So it's going great. We're hoping to have our ribbon cutting in another week or two.
Awesome.
So more space. We kind of outgrew what we were in, and we're actually going to be bringing in a DEXA scan, which typically when people go and get a DEXA scan, they're looking at bone density.
Yeah.
But this also allows us to look at visceral fat, so we can see where the visceral fat is on a patient, and then monitor. You know, once they start treatment, and being able to show them where you're losing that from, you know, as well as monitoring, you know, the bone density. But I think it'll open a lot of people's, you know, eyes to, you know, really seeing, you know, where that fat is.
Yeah, because I mean, I think that that's something that, you know, because Ozempic exists and because people can have this rapid weight loss, they meet us and they make the assumption that they may lose a lot of weight quickly. And if they're doing the right things with their diet and, you know, getting their steps in and, you know, we balance their hormones in the right direction, it does move that way. But like Rita suggested, the first thing to go is that visceral fat. So sometimes the outside doesn't change dramatically. You may notice even the scale doesn't necessarily move, but if you're losing fat, that's what you want to lose. You don't want to lose muscle. You don't want to lose bone density. So the fact that can, you know, that we can see that and visually show them, hey, this is what's changing. Or even somebody that's not part of the program yet. Hey, this is what needs to change, and we can target that. You know, because that's the other side. People get an ultrasound done, had, you know, right upper quadrant pain, and they have gallstones, and they're told, hey, you have a fatty liver. Yeah, lay off the alcohol. It's not just lay off the alcohol. It's lay off the alcohol, the carbs, and get your hormones balanced so that you can make that disappear. The idea that has to stay and change and doesn't change and can't be fixed is a falsity. Because if you rev up somebody's thyroid hormone in the right direction, you get their testosterone levels to where they should be. And if they're a woman, bring back estrogen into their life, like magic, it melts away. And then the machine just works better.
Is that like menopausal too? Is that kind of what
happens?
Yeah.
I mean, that's what you hear. I mean, you see that all over social media, you know, like, oh, all this menopausal weight that I've gained. And that's exactly what's happening.
So it's not just one thing causing it or giving up one thing. It's multiple things you got to change across the board.
And that's why we have that 3-pronged approach. But can help balance your hormones. I can make suggestions about what you need to do with your body in order to move things in the right direction. And here are the suggestions of what you should be doing with your diet. If all 3 of those things are moving in the right direction, do people lose weight quickly? Absolutely.
You know, we tell patients, you know, we don't need you in the gym doing CrossFit. You know, I was somebody that did, you know, I ran competitively all the way through college and then did triathlons, kind of beat the crap out of my body. But really what I was doing is creating so much inflammation, which then, you know, you're holding on to more fluid, you know, you're doing more damage, you know, doing those, you know, hard workouts like that. So we initially tell patients, just want you walking. It's amazing how much fat you can lose with walking.
Yeah.
10,000 steps a day, every day for a week, you'll lose a pound of fat, regardless of changing your diet or anything else. Yeah. So just think, you get that in, you did some diet modifications, we balance your hormones, you know, where we could be. You know, eventually then we'll tell you, you know, once you're able to have more energy, you've lost, you know, the weight, well, then now we can do a little, you know, weightlifting, you know, nothing crazy, but we want to maintain some muscle mass, especially for females as we age. But yeah, it's nothing, you know, we don't want to create inflammation.
So I find successful people always have a process. And since we have 2 of you, do you each have a process, or is it one process because of where your backgrounds come from, right?
Well, I'm an MD, so I think that Rita learned a little bit more in her DO schooling in terms of manipulation and those kinds of things. But the reality is that their line of thought is very different. Kind of,
mind, body, spirit, the whole person versus, thinking, you know, trying to come to, what is the actual root cause of my back pain, not just treating the back pain. And I think that's how our approach kind of is, now, like looking at everybody hormonally, metabolically, listening to what their symptoms are. Because I think that's the biggest complaint. My doctor doesn't listen to me, in the 7 minutes that I get to sit with them, which is the reality.
It's funny because you tell them what you think is going on and you're like, "Hey, listen, I don't think this is right." And they're like, "Ah, you're good. I checked it."
Yeah.
Well, it's not, because you know your body. You kind of know that something's not right.
I mean, and we talked about levels briefly, the reality is testosterone level of 700 for man A versus a testosterone of 700 for man B can be dramatic in terms of what their body's response is. Some people just need more. Some people need less. And again, that's why it's not a cookie cutter scenario. That's why I'm tell you that, oh, I'm going to bring you to 1200 and we're going to stay there. Kind of depends. 1200 may be perfect, but maybe you only need 1000. I personally needed a little bit more. Now I feel stable. But in terms of process, we started this. I think that our goal was to see kind of rev things up enough in our side gig, for lack of a better way to describe things, and then slowly transition out of the emergency department. I think that Rita and I got to a frustration part of things where we were like, what are we doing with this 45-year-old guy that comes in? He's heavy. He doesn't know he's diabetic. He smokes a little bit. He's here with chest pain. Gets admitted to the hospital, a whole slew of tests. Make sure he's not having a heart attack once he's upstairs. He gets discharged on a statin, something for blood pressure. No lifestyle change at all is involved in that at all. Comes back in 2 years with the same complaint. I have chest pain again. He's a little bit fatter. Nothing has improved except for maybe his LDL, if he's taking his medicine like he's supposed to. So, and yet the process starts again. He leaves with a new $16,000 bill. No change, no improvement. That part of things, it keeps people coming back to the emergency department, but are they better? Isn't that supposed to be the focus? That's why I wasn't being listened to. I was like, why don't we try to create something where we actually listen to the patient, we sit down with them for a good amount of time, we have an open patient-doctor relationship, see how things go. And it's been very successful as a result because we're trying to do things.
I mean, it's really scary. We're kind of, my brother says we're just killing off our species. I mean, 85% of our population is metabolically unhealthy. I mean, that's insane. The amount of like type 2 diabetes in kids, is just the highest that it's ever been, and they're getting younger and younger and younger because you look at these kids, and it's because there's processed foods, they're not sleeping, well, and it's just, we're starting earlier and earlier. So it's really sad.
Well, it's also, I find it just like the video game. I mean, we were outside every day.
Yeah.
Right. We were outside. We talked about this. I talked about this a couple of days ago with a buddy of mine who runs a couple of gyms. He's like, when we were kids, they would say, go out and play, and you would just make up a game and you would roll. Kids nowadays, they're not making up anything. It's either a video game, a phone, or whatever it is. And some of them will go out and play, but they're not outside for 12 hours like we were.
So you're not moving. So, you're not teaching good habits at an early age.
Yeah. I mean, the reality is that everything in the center of your grocery store is probably stuff that you should stay away from but that's exactly what kids are drawn to. You can walk down the center aisle of any grocery store. Everything is in the right color scheme to attract attention, to draw kids to eat the wrong thing. It just gets worse and worse because we're so busy and parents are busy and, it's a setup for failure. And I think if medicine was doing the right thing every time, then it would be impossible to say that 85% are headed in the wrong direction or metabolically unfit. That to me says that we're doing it wrong.
I mean, you walk into the CVS or Walgreens and you just look behind at the counter. How many bags of prescriptions are just hundreds. And it's like crazy, or when someone walks in and their medication list is 20 meds, you're like, because you give somebody one medicine and then they have a reaction, or to whatever, and then now they're on another med, and then it just kind of snowballs. Instead of trying to figure out the root and preventing, we just react.
Something non-prescriptive. What would you say is like the 2 things somebody should take every day? If they had, if they're not going to listen and they're not going to check you out, if they're not going to sign up to have a conversation.
There is a supplement that everybody should take. It's probably vitamin D. I think vitamin D in a bottle is a vitamin, but inside your body functions more like a hormone and makes your other hormones work better. You probably flip through TikToks where you're like, it says, I took ashwagandha, valerian root, and vitamin D, and I lost 30 pounds. Probably had nothing to do with valerian or ashwagandha. Those things can, calm you and make your mood good and those kinds of things. But vitamin D will make your thyroid hormone work. And so for some people, that's all that's necessary in terms of moving the needle in the right direction. That being said, supplement that's good, like if you're lifting and working out, I think magnesium is a great supplement to take on an ongoing basis. If you get the right one, it can help with sleep. So magnesium glycinate and magnesium threonate are the 2 that cross the blood-brain barrier and kind of can help in that regard. Definitely help with muscle soreness for people that are like, trying to lift and do the right thing. It was something that for me, I noticed I was like, started lifting again and doing those kinds of things. And soreness was, I don't want to say debilitating, but kind of turned me off. Like, I don't want to be in pain again. And that just helped quite a bit.
What about vitamins besides Flintstones?
They taste good. Come on.
Well, they're great. They're great.
So I kind of buy into the idea that there's a lot of people that don't methylate or have the ability to methylate their B vitamins. And so if you're going to take a vitamin supplement, you should probably take one that is methylated. So in order for your body to be able to do work with those B vitamins, methyl group has to be attached. But unfortunately, there's about 45% of the world population that can't. So instead, they take this vitamin, and then these levels actually get almost to a toxic point in their body because they can't use them. So they think they're doing the right thing by taking a vitamin supplement, but if your body can't use it, then it's just getting kind of stored in your body. It's to joint pain, muscle ache, and those kinds of things. So grand scheme of things, if there's a vitamin that you should take, they're all probably okay as long as they're methylated. And, there's tests out there. There's other people that, you could take a genetic test in order to make sure that, to see if you're somebody that methylates or not. Or you could just take a methylated vitamin.
So methylated vitamin and vitamin D.
And I think, and so with the vitamin D, make sure it comes with vitamin K. Okay. Didn't realize this either, when we were, years ago, but vitamin D, some people don't have they don't absorb it well unless it's with vitamin K. Vitamin K will help open doors so you can absorb more of the vitamin D. Okay. So usually it'll come in D, A, and K. So definitely recommend that. Okay. And I think the other thing with the supplements is making sure it's a good supplement. There's so many that are out there that they make them look pretty. Jason's always saying they're putting them in the shape of a star or, whatever. Well, when they do that, they add all this crap to it, and then all you're basically doing, you're not absorbing it. You're just going to pee it out and you're wasting your money. So we always recommend a micronized vitamin. Basically, that means it's shaved down to the actual product. There's not all these other fillers so that your chances of really absorbing it, are good.
Is there anything on the horizon besides the new office opening that we should be aware of?
Well, I mean, like Rita said, we're bringing a DEXA scan in, but I think we're going to continue to expand our reach, so to speak, and there's probably won't be a state that we're not going to be able to come and visit and help care for people. I think in general, hormones are at least being talked about more frequently. Mm-hmm. Even people like Holly Berry has some kind of new podcast where she's constantly talking about things in this regard as some of those celebrity folks get to this stage of that life. But the reality is that it doesn't have to be somebody that's in their 50s. Now, we're not giving testosterone to a kid that's 30 years old because we don't want to prevent any kind of fertility problems in the future. But for women, sometimes PCOS has nothing at all to do with the ovaries themselves and has to do with dietary changes and insulin resistance. And so for us, if there is a cat out of the bag that's going to happen, I think more and more people will realize that insulin resistance is probably the root cause of all things bad. Cancer, heart disease, and it's something that can be fixed. Do we need to make change? Absolutely. There's no question. But it can be done. Mm-hmm. You know, my insulin level at one time in my life was 25. Now it's 3. Because it can get better. Talked to my doctor way back when. I don't take metformin. I don't take a diabetic medication. No, I take hormones. Yeah, I do.
You just made the changes that you needed to, right? You took it. It was the time to make the changes. And usually that's what people do, whether it's financially, whether it's wellness, whether they wanted to be a part of it, they have to be ready to make the change.
Right.
You know, we interview and talk to other people because we, as Compass and, you know, working with Brennan, we're worried about, you know, their financial health, wellness, and happiness, right? So to talk to you guys and figure it out, if you could give us, as we wrap this up, one piece of advice that you would give each of you to the people listening.
Very important, you know, for hormone replacement for women. You know, I'm going to be a strong proponent of that. Once you do hit menopause, just to be able to, you know, protect that brain, your heart, and your bone. So really look into that. You know, we always tell patients, we can't make you live longer, but we want you to live well while you're here. So
all in all, I guess the best part is for us, something that I wanted you guys to go away from is you're not your numbers. You are whoever you are, and it may not have anything to do with numbers. And so if you're feeling poorly, but you're being told that everything looks normal, I'm sorry, you're just getting old, don't stand for it. Find somebody that will actually listen to you.
And that's a great piece of advice right there. Don't be the numbers, be you.
And that's why we named ourselves, you know, Optimized, so that we can get you optimal.
Thanks for coming on. Thanks for talking. Good to see you in person finally, besides over a computer screen.
Thank you.
Besides a computer screen, and maybe we can make this on the regular and just keep updating what's going on. All right? Thank you so much.
Thank you.
Thank you for listening to the Compass Wealth Conversations podcast. Click the follow button to be notified when new episodes become available. Visit our website at www.mycfsi.com. That's www.mycfsi.com. Or give us a call at 610-449-9900. And don't forget to click the follow button to be notified when new episodes become available. The information covered and posted represents the views and opinions of the guests and does not necessarily represent the views or opinions of Compass Financial Solutions Incorporated. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning. Please note that the information provided in this podcast is for general informational purposes only. All opinions expressed by the hosts and guests are solely their own opinions and do not reflect the opinions of any institutions or entities they may be affiliated with. This podcast should not be considered as financial or tax advice. We strongly recommend consulting with a professional financial advisor or tax professional to get advice tailored to your specific situation before making any financial decisions.